So, hi everyone. I hope every one of you is doing fantastic and you would have taken your entire sleep, would have taken your good food, would have met your friends, family, girlfriend, and boyfriend, and would be someone who would be still on a trip. Please, guys, enjoy this moment. This moment is something that you have gained for yourself. इस चीज को मत गवाओ. पीजी में एंटर करो या पीजी में एंटर नहीं करो. This is going to be a tiring journey for you. तो अभी जो टाइम मिला है उसको full on enjoy करो. ओके एंड इफ यू आर स्टिल ऑन अ ट्रिप एंड यू डोंट वांट कि मैं आपका मूड खराब करूं या फिर आपको कोई फालतू की फ्री की एडवाइसेस दूं तो प्लीज स्किप दिस वीडियो. दिस इज नॉट फॉर यू. फॉर द अदर्स हु स्टिल आर कंफ्यूज, आर द इंटर्न्स, पोस्ट इंटर्न्स, डू नॉट नो व्हाट टू डू, हाउ टू डू, this is something self analysis that I have designed for you. This is an analysis thing that you have to do on yourself and then we will be discussing about the different strategies. Also, one advice that I wanted to give to every one of you is इस समय सबसे important 3 लोगों से दूर रहो. पहली चीज, those who think were your competitor and now they are trying to be very empathetic, very compassionate towards you or are being very super familiar towards you, please stay away from them. Second, especially from those platforms or the Instagram people who are trying to predict your rank. भाई और बहनों, आप लोगों ने पेपर दे दिया, पेपर आपने दिया है, रिकॉल आप लगा रहे हो and most of the people would not be knowing कि मैंने ये रिकॉल सही भी लगाया या गलत. From these recalls you are predicting your marks and on these predicted marks you are interpreting a probable rank. How is it possible? Please guys, NB को अपना काम करने दो, भले ही स्लो करेगी बट करेगी. So do not get panicked about that thing. उनको वो काम करने लगो. And the third important advice, you have to be away from your self doubts. मैं कर सकता था, मैं नहीं कर पाया, मेरे से अब नहीं हो पाएगा, या फिर मेरा पोटेंशियल इतना ही था, मैंने तो दे दिया. नहीं, abhi all these 3 things you have to be away from all these things and now you have to focus on your further plans. Now how are you going to analyze your plan? Let's see. Let's look into it. So yes guys, so 1 week post NEET PG, what next? So I have divided it into 2 main broad categories. One who are starting fresh and the another who have already given NEET PG. Now people who are starting fresh could be the interns, the ongoing interns who are still in their internship duties, and the people who are the post interns जिनकी internship अभी खत्म हुई होगी and then they gave this exam within 1 to 2 months of their after their internship. Okay, so if you are an intern, first and foremost important thing, platform select कर लो. It could be any platform, be it Mero, be it Cerebellum, be it Prep Ladder or Dams, Bhatia, whatever you want to choose. Stick to this source and do the revision videos from these platforms. Now how are you going to approach for these revision videos? First and foremost thing, you have to watch the videos along with the posting. सपोज आप लोगों की पीएसएम की पोस्टिंग चल रही है या फिर आपकी कोई सर्जरी ऑब्स गायनी की पोस्टिंग चल रही है, यू हैव टू गो एंड वॉच द वीडियोस ऑफ दैट पोस्टिंग. बट हियर इज अ कैच. अगर आपकी किसी ऐसे सब्जेक्ट की पोस्टिंग चल रही है दैट इज अ 4th ईयर सब्जेक्ट लाइक सर्जरी, ओबीजी, मेड, ऑर्थोपेडिया, please I will suggest you to read anatomy and pathology first rather than those subjects. देखो, you are fresh interns, you would have passed this 4th prof recently and you would be having a basic knowledge about those subjects. So at this point of time, don't you think that rather than again going and diving into the same videos, it's better you go into the previous anatomy aspects, especially related to OBG. आपको पता होना चाहिए pelvic diaphragm का काम क्या होता है, आपको पता होना चाहिए when you are going for gastrectomy, where is stomach located, what are the posterior relations of the stomach. Then similarly, if you are going for ortho, you should know about the upper and the lower limb muscles and the nerves. So it will be better add on to your preparation. If you are currently posted in the 4th year postings, you have to go and read the anatomy and the pathology. That is the first and the primary thing that you have to do. Okay, second thing, if you are in the posting of other profs like ENT, FMT, Opthal, go with that. ENT के videos देख लो, Ophtha के videos देख लो. Please watch revision videos. Do not jump into the main videos until and unless you have zero idea of the subject. And I at this point of time think that हम सब passed out है भाई, हम सभी लोगों ने NEET UG क्रैक किया है. We all have a very good brain. So every one of us will be having the knowledge about the subject. So please do not think, just start with the RR, start solving the questions, and after that we will see that whether you are able to do better in this subject or not. But if you are having a fear of any subject, like I was having a fear of anesthesia, so I did the main videos for anesthesia during my internship time only. Next, if it is easy and less hectic posting like PSM, please complete biochem and microbiology. I think I did not write it here, but yeah, you have to complete microbiology. देखो गाइस, लास्ट में ना बायोकेम एंड माइक्रो जिसकी स्ट्रांग है उसकी रैंक पक्की है. आई एम टेलिंग यू व्हाई, बिकॉज दीज आर द सब्जेक्ट्स जो कि पिन पॉइंट क्वेश्चंस पूछते हैं. अगर बायोकेम में क्रेब्स साइकिल का एंजाइम पूछना है तो आप चाहे हुक और क्रुक मेथड लगा दो, अगर आपने ये नहीं पढ़ा है, you're not going to solve it. It's as simple as it is. Similarly, if you don't know that McFadden reaction Bacillus anthracis deta hai, you are not able to crack that bacteria. So please do not waste your time just reading PSM for 3 months. It's not something that you should do ideally. So this is something. Next, read system wise. This is something that I realized very late during the time of my 6th month of internship. You know, ideally, I guess in UG days, सब कुछ ना systematic basis में पढ़ाना चाहिए, but ऐसा नहीं होता है. But from our side, what we can do is we have to do it as much as systemic we can do. So, for example, you are in a medicine posting. Ideally, you should start with physiology. Start with physiology and physiology का renal portion पढ़ दो. Suppose आपके पास कोई patient है और उस patient को suppose MI या DK है या फिर कोई CKD का पेशेंट है, यू आर इन द डायलिसिस यूनिट, सो रादर गो एंड सी दैट पेशेंट, प्रैक्टिकली उसे देखो, देन गो बैक इनटू द रीनल फिजियोलॉजी, देन इनटू द फार्मा, देन द पैथो एंड देन द पीडिया एंड द मेडिसिन एस्पेक्ट. दिस इज हाउ योर प्रैक्टिकल एंड द थ्योरेटिकल नॉलेज इज गोइंग टू इंटीग्रेट इन सम टुगेदर. Okay, now attend each posting, guys. Do not leave the short posting. This is what I have also done and many of your seniors would have done, so you don't do that. Okay, ideally, you know, we tend to miss the postings like psychiatry, derma, but I will suggest you do not do that. Okay, next, don't jump directly into the GTs till the next 3 months until and unless you have done some amount of the detailed study of subjects. Please do not jump into the conclusions. Okay, now at the same time you have to enjoy the internship. एक ही बार मौका मिलता है जहां पे 19 के 19 if not 19, so at least around 14 to 15 subjects are getting exposed to you. Please find out your interest and then you can proceed accordingly. This is what is a very rough analytic plan for the interns. What about the post interns? अब भाई आप post interns हो, आपने नीट दे दिया या जीटी दे दिया, नीट दे दिया, रिकॉल दे, if not give a GT, analyze yourself. Analyze करने के बाद we will start, and this post internship entire strategy I'm going to upload at the first. Okay, second thing, now if you have given the NEET PG and now you are sorted कि भाई I guess I'm getting a good rank and जो भी मैंने सोचा था उससे ज्यादा ही मुझे मिल गया है, enjoy, wait till the results and then we will be following it after. But if you are someone who is very anxious कि क्या होगा, मैंने न जाने क्या किया है, इस बार तो बहुत ज्यादा इन्फ्लेशन होने वाला है, people, so many other Instagrammers are telling that नहीं 160 पे तो आपके 10,000 आएंगे, तो please do not waste this time, start reading for INI CET. Simple. You can't have these anxious ruminations again and again, भाई अब क्या होगा, अब क्या होगा, अब क्या होगा. नहीं, ऐसा नहीं करना है. You know, for this exam, what are the things that we do? Last time, 11th August was the day when it was NEET PG, and me and my friend just on 8th of the August, I don't know what was that Lion portal, और हम Lion portal में ना बस अपनी wishes लिख रहे हैं, as if just by writing into the Lion portal I would be getting the desired branch. So ऐसा नहीं होता है. So please do not be in very fake in the virtual world. Please try to be more and more practical. So at the same time, if you feel that you are very anxious and you don't know कि क्या हो रहा है, मेरी रैंक क्या होगी, सो क्यों उस पे वेस्ट कर रहे हो? रादर स्टार्ट प्रिपेयरिंग फॉर INI CET ना, अपनी एनर्जी को INI CET पे लगाओ. दैट्स व्हाट यू हैव टू अप्रोच. नाउ कम्स द मोस्ट इंपॉर्टेंट पीपल हु आर इन अ डायलेमा है. You have to ask few questions to self. Take this screenshot of this page of this flow chart और इन questions को अपने से पूछो. Comment section में मुझे बताओ क्या आपका final result आया है. So first, was my preparation adequate? If the answer is yes, then ask another question. Was it my full potential of preparation? Okay. Now, if the answer to the previous question was my preparation adequate? No, then you have to find your loopholes. Those loopholes could be anything. You didn't read adequately. जो आपको पढ़ना चाहिए था आपने नहीं पढ़ा. Second, concepts were not clear. You did not know कि मरमर कैसे आ रही है. You were just reading कि ग्राम बेल मरमर इसमें आती है and another mid diastolic मरमर इसमें आती है. But you don't know the concepts. And this time the questions were related to these concepts too. Question solving skill. If you are lagging in the question solving skills, you have to find that. You have to solve more questions. Next, if there was a last day anxiety, this happened with me, it is very bad. Last day anxiety है, इसको focus करना है, इसको कैसे ठीक करना है, you have to know this. Second, silly mistakes. देखो ऐसे easy papers में बहुत silly mistakes होती है, तो those people who had silly mistakes, you have to find into your loopholes. Revision was inadequate. आपको पता चल गया कि कमी आपके revision में थी, you have to focus on that. कैसे focus करना है? Let's wait. कैसे करना है? I will tell you. But yeah, if you feel that your preparation was not adequate, you have to find your loopholes. But if you feel that the preparation was adequate, and you have to next ask the question, was this your full potential preparation? If the answer is yes, ask this question to you. Are you done with the exam? If the answer is yes or the no. If you feel that you are done with the exam, wait till the results. After the result, just see, are you getting the branch as you wished? If yes, grab it. Welcome, you are a PG resident now. Khatam, story khatam. But if you feel you're not getting a desired branch, now just see, are you happy with any of the branch? Many people have this thing कि मेरे को clinical में कुछ भी मिलेगा मैं खुश हूँ. कई लोगों को होता है मुझे clinical ही चाहिए, non clinical होगा तो मैं नहीं हूँ. So you have to find it. This is your subjective happiness, your subjective target and goal. If it is accomplished, congratulations, you are out of this horse race. ठीक है? But if not, if you feel that you are not getting the desired branch as you wished for, attend the counselling till the end, and meanwhile either move forward कि भाई अब जो मिला है मैं इसमें खुश हूं, I will move forward, or just start preparing for INI CET or for the NEET. I will tell you one thing here. Many people think that non-clinical branches are not good, but I am telling you non-clinical branches have a very good scope in the future. Be it patho, anatomy, physiology or biochemistry. Just look at anatomy. I don't know, there's a very famous Instagram person, just you can find, I don't know the name exactly, but he did anatomy, and then after that he is now doing it as an embryologist. IVF center he has opened, and see, paisa kama rahe hain. At last everyone's goal is to have the money. But then at the same time, if you think that there are other factors that are coming into the consideration and you want to take, please इन सबको outweigh करो, अच्छे से देख के analyze करके ही आगे बढ़ो, because it's finally your life, your career. Next, ऊपर वाले क्वेश्चन में चलते हैं. If you feel that your full potential of preparation was not so enough, please restart, find your potential, and then find your potential. Now how? You know ना, आप सब लोग PCB निकाल के आए हो, be it anyone, be it from the private or the government hospital, you all are doctors man. आप लोगों ने 4.5 साल का मेहनत करा है. You have done that entire 4.5 years of preparation, your hard work, वो prof से पहले की sleepless nights, and then internship, सब किया है. You all are at the same level. We all are at the same level. Just the simply thing is that I am now pursuing my PG in psychiatry, so I will be a specialized person in psychiatry. But MBBS का basic knowledge तो सबको है ना. So please आप सब ना एक level पे हो. किसी को खुद से ज्यादा मत समझो, किसी को खुद से नीचे मत समझो. Please, at any point of time you get the chance to grab something from someone, be it anyone, प्लीज ग्रैब इट. हर कोई इंसान आपको आपके इस पूरे टेन्योर में कुछ सिखाता है, बी इट फ्रॉम योर पेशेंट्स, बी इट फ्रॉम योर कलीग्स, बी इट फ्रॉम योर सीनियर्स, एंड ऑल्सो फ्रॉम योर जूनियर्स, स्पेशली ऑल्सो फ्रॉम योर नर्सिंग स्टाफ एंड अदर वर्किंग स्टाफ. सो प्लीज किसी को अपने को खुद को बड़ा मत समझो और खुद को छोटा नहीं समझना है. दैट्स व्हाट आई वांटेड टू टेल यू, दैट कई लोगों के दिमाग में ये एक बहुत प्री नोशन होता है दैट मैं तो प्राइवेट से हूं, मेरा तो क्या ही होगा, मुझे गवर्नमेंट सीट तो कैसे ही मिलेगी. मिलती है, ठीक है. दिस इज ऑल योर हार्ड वर्क दैट फाइनली पेज ऑफ. सो प्लीज स्टार्ट विद दिस मोटिवेशन. पहले से ही सोच के रखोगे कि प्राइवेट के बाद मेरे को गवर्नमेंट नहीं मिलेगा तो कैसे चलेगा, ठीक है. नाउ इफ यू फील दैट यू आर नॉट डन विद द एग्जाम, क्या वेट कर रहे हो? जस्ट स्टार्ट प्रिपेयरिंग फॉर INI CET फ्रॉम टुमारो. बट हाउ? दैट्स व्हाट वी आर गोइंग टू डिस्कस इन आवर नेक्स्ट वीडियो. टिल दैट टाइम अपने आप को इन 4 पार्ट्स में रख के एनालाइज करो, मुझे बताओ आपने क्या चूज किया है, एंड देन टुमारो और डे आफ्टर टुमारो आई एम गोइंग टू मेक द full plan strategic video that how you're going to approach further. Till that time, enjoy, have a lot of cheesecake, good food, and bye. Take care.